Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what is a lurch? Okay, lurch is a painless deviation of the trunk. Okay, in lurch is actually a painless lesion. Okay, in the lurch, the trunk deviates towards the disease side. So while the patient is actually moving or while the patient is actually walking, trunk deviates towards the disease side in the lurch. So what are the causes of the lurch? Lurch can be caused by developmental dysplasia of the hip, poliomyelitis, and superior gluteal nerve palsy. So lurch can be caused by developmental dysplasia of hip, poliomyelitis, and superior gluteal nerve palsy. Okay, this lurch can be either unilateral or it can be bilateral also. If it is unilateral, this is called as lurch or lurching, or we can call it as abductor or Trendelenburg gait. So lurching, that is deviation of trunk to the disease side, is present unilaterally, then it is called as lurch or lurching or abductor or Trendelenburg gait. Whereas if the lurch is present bilaterally, then we call it as duck waddling gait.
thank you and thank you for watching.